Sterling Medical has been moving forward in the healthcare arena since 2012. As we have accomplished many milestones, our values have become clear as to how that has been accomplished. Today, I would like to expand on the values that Sterling Medical makes decisions on, engineers growth through, and looks into the future with. First, as we hire and look for the best of the best, we strive to pick individuals who are coachable. What does this mean? We're not looking for the most educated person or people with the highest IQ. By contrast, we don't discredit someone for lack of experience. We look for people who are like an athlete. Coachable people are willing to trust and try new things to make them better in whatever they do. Likewise, those individuals that have a hard time adapting or are unwilling to learn new things struggle in our environment. A great story that we can relate to is Daniel in The Karate Kid. Mr. Miyagi invited Daniel to learn from him using unusual methods. These methods included paint the fence, wax the car, and other common chores to teach the basic karate moves. If Daniel had not been coachable and trusted Mr. Miyagi and not been willing to listen and do what he was asked, he would not have learned the lessons that made him a champion. One of our own examples is Taylor Hale. Taylor was noticed at a local restaurant at closing time, cleaning under the tables and the booth walls while laughter was heard from his coworkers in the back room. He was approached with a card and told to apply. The next day he showed up and was given a job. He started at the ground level and has been promoted, giving him a terrific understanding of all aspects of the company. As a result of being coachable, he has been a valued contributor to all the changes and growth that Sterling has experienced.
As we were identifying our rock stars on Sterling Medical's team, the characteristic of hard worker kept coming up. We needed to dive deeper into what this really means. In the Sterling way, we came up with a great line, finishers wanted. You see, finishers are like rhinos. When they are confronted with a problem to solve or a threat, they charge forward until the problem is solved or the threat is vanquished. They are problem solvers. They don't leave anything unfinished for the other guy. They know where to go for answers and they follow through until a task is finished. Team members that don't make it within Sterling's environment are ones who remain unmotivated, they are unchallenged, they have a sense of slothfulness and lack of urgency. Devon Dalkey, one of our rock star providers, is an excellent example of finishers wanted. At one point, there was a patient who came in to be seen for abdominal pain at one of our clinics. He was a gentleman in his early 50s and he had abdominal pain for approximately 4 days. His wife was concerned because getting him to be seen in a clinic meant that something was wrong as he didn't frequent clinics very often. Even though his exam did not yield a diagnosis, the provider had concerns. Blood work and a CT scan were ordered. Even though it was later in the day, the local hospital was able to fit the patient in. The provider received a phone call from radiology about his results at around 10 p.m. There were concerns for a possible cancer diagnosis. The provider contacted the patient that evening and arranged for surgical evaluation within 48 hours. The patient was in surgery within a week and his care was able to be coordinated for the best treatment possible given his situation. The patient and his wife returned to thank our provider in person as they were grateful that the provider helped solve their problem. The wife admitted that if the provider had not acted promptly, her husband likely would not have returned and in this case would have been devastating.
Candace Fernandez has been a remarkable example. She is so willing to get in and solve problems, make things work, and acknowledges when she might have made a mistake. She is not only a finisher, but she is also very coachable. She takes on new roles and responsibilities with little to no training and figures things out. She is not afraid to do the hard things. We would be lost without Candace. Our moderate complexity labs are very labor intensive. Just ask Fred Markham. He was placed over the labs 3 years ago. He has labored diligently with each location, has set them all up for CLIA inspections, has attended every inspection and followed up with the inspectors regarding their requests. Training, answering questions, setting up controls, making sure all the paperwork has been reviewed and signed. This is not a simple task, and this is one department we have never had to worry about. These are just a few cases in a sea of millions. We have providers, medical assistants, operators, receptionists, billers, managers working tirelessly on so many issues, problems, events, and situations. This leads into our third value, a concierge attitude.
Sterling has been built with a differentiator regarding healthcare. We want to be able to get rid of the middleman and be able to bring the patient-provider back together. This requires a significantly different approach than the traditional healthcare system out there. Most have the mindset if we build it, they will have to come if they want to get better. Sterling has the mindset, help us build it so that you feel like family when you come. This value is very strong in our system. We have even allowed the difficult to find provider who doesn't get the concierge attitude to progress somewhere else. More than one, I might add. A great example of this attitude can be found within our departments to include case management, occupational medicine, those who work with our employers, the receptionist and clinical staff, and especially our providers. Devon Dalkey has been an excellent example of a concierge attitude. Devon has given his personal phone numbers to many patients. They call him at all hours of the day. He comes in to see patients who request him on his days off. All our employers' CEOs know him by name and will call him when they are on vacation. Sammy Evans will never be able to leave Sterling. Our membership platform has been built on Sammy and her relationship with the employers. She is always answering phone calls and fixing problems. She always does it with a smile. Our response is that we may not be perfect, but our response will always be perfect. She never lets someone wait for an answer. She isn't afraid to address problems. She is a rock star. Awesome receptionists to include Michelle Fuller, Michelle Fellows, Ashley Harrison, Lori Heiner. All these ladies have dealt with very unpleasant situations, and they have done it with dignity and grace. The reception position is one of the hardest ones in our clinics. They are the face of the clinics and get the brunt end of a patient's feelings. These men and women who take this position and excel are diamonds in the rough. We thank you.
As everyone who has worked here, even for a minute, realizes that change is happening all around us. This isn't new for a healthcare company, but those individuals who meet change head on and thrive will love Sterling. This leads us to look for those individuals who remain flexible during a constant sea of change. This isn't very easy and can get highly stressful. We acknowledge that 86% of workforce either doesn't like change or really hates it. The other 14% really loves change or doesn't even notice it. Because of these statistics, we understand that we need to communicate, which may not be ideal all the time, but we are constantly trying to change that as well so that we can improve. If there is one thing that we have learned from the COVID-19 pandemic is that change is constant. At the beginning of the pandemic, we put on gowns, gloves, and personal protective equipment to see patients in their cars in the parking lot of our clinics. Often this was done in extreme cold, heat, snow, or rain. As the pandemic situation changed, many of the clinics were able to dedicate rooms for COVID testing and bring our testing indoors. When the vaccine became available, many of our locations did on-site clinics for businesses. With every curve COVID has thrown at us, Sterling has been ready to adapt and change our processes as needed to provide care for our patients and communities during a pandemic. We have also been flexible regarding healthcare and the services we provide long before the pandemic and will continue to be flexible long after the pandemic. We have found that those who are resistant to change and unable to adapt will not thrive in our Sterling environment.
Our fifth value is one that is extremely important to be able to continue to grow and expand. This value is trust. Trust is, of course, both earned and given. It takes time to develop and there are two parties involved. In the employment world, trust must be earned through accomplishments. Employees need to earn the trust of their supervisors and managers by completing their duties, projects, and assignments. They do not need to be perfect, but there needs to be a demonstrated history of competency. In other words, you must prove that you are worthy to be trusted. A short definition: trust equals goal alignment plus competence. Our Rockstar team members that have earned the trust of their coworkers, their manager, and even the CEO have a certain set of qualities that have helped them build that trust. First, they assume good intent that people they work with will try and do the right things. They focus on providing facts and context so people can make rational decisions. They don't spread gossip or contribute to backbiting. They have self-confidence. They understand that failure at something also has benefits. They are not afraid to be bold and try something new. They understand nothing good comes without risk. There will be times that they try something and fail. So long as they learn from that failure and become wiser for it, it's not really a failure. When you trust someone and they succeed, you win. If you trust someone and they fail, experience is gained. The team grows and you still win. Our rock stars set clear goals which align with the vision of Sterling. They understand that they don't know everything and they are coachable in learning new things. They also understand that it is good for them when their manager checks in on them and holds them accountable. This is something that they look forward to. Jody Zielinski is a wonderful example of someone on the billing team that is trusted. She is competent, level-headed, and doesn't get involved with the office politics. She is willing to take on new things and speaks her mind when things need to be changed. Rosemary Sharp is another example of someone that can be trusted. She shows up to work, puts her head down, and plows through her tasks. She doesn't balk at additional assignments or things that she must learn. For myself, trust is one item that I must have on my management team. Each person in that room has a specific role and are privy to confidential information regarding the company and those who work in it. If I lose trust in an individual, no matter their skill set, they will not grow within this company. This is how important this value is for Sterling Medical.
Finally, our sixth value, family. This is one of our greatest blessings with Sterling. Having such wonderful rock stars to work within Sterling Medical is by far the best job satisfaction that we have ever had. We are one to take responsibility very literally, and when we see or hear of one of our own team members suffering, we feel a personal connection and try to reach out. With that said, Sterling Medical's policy has always been family first. We understand that if things aren't right at home, they won't be at work either. As a senior management team, we only have control over what happens while at work. Research conducted by Ellen Galinsky at Merrick & Company concluded that employees who perceived their supervisors as unsupportive on family issues reported higher levels of stress, greater absenteeism, and lower job satisfaction. There have also been numerous times when employees have had financial hardships and Sterling team members have reached out to help them in that time of desperation. There have also been other circumstances when Sterling has catered or reached out to assist our employees and their families. We have also done this with complete confidentiality. It's for helping the struggling team members so that they don't have to feel alone in this crazy, uncontrollable world. Isn't that what families are for?